A duodenal switch is a combination of a restrictive and a malabsorptive procedure, and the malabsorptive component of the duodenal switch is a lot more effective than in the gastric bypass. In a sense, you could think of the duodenal switch as a combination between a sleeve and a gastric bypass. So we reduce the size of the stomach, which makes it easier to feel full so patients eat less. And then there's also a rerouting of the intestine that also limits the body's ability to absorb calories. So you lose weight not only from eating less, but also from absorbing less as well. This is a procedure that has the most weight loss compared to the other procedures and has a more durable weight loss as well. The duodenal switch shows a higher remission of diabetes compared to gastric bypass and laparoscopic gastric sleeve. It also shows a higher excess weight loss and also a more durable weight loss. In some longitudinal studies, the duodenal switch showed that the weight rarely came back, whereas after some of the other procedures, some patients will gain the weight back. And moreover, the patients that tend to gain the weight back after the other procedures tend to be the patients with higher BMIs. The right patients for the duodenal switch is essentially any patient that has a BMI greater than 50. These are the patients that tend to benefit the most. It is a procedure that does have more weight loss, and for that reason, it has to be applied to the right patient. But whenever you look at the other procedures out there, those procedures don't tend to perform quite as well as a duodenal switch in that patient population with BMI greater than 50. There's ample literature that shows the duodenal switch to be the most superior weight loss procedure for patients with BMIs over 50.